to markets at noon and monitoring what's going on with the vaccine progress in the country after glitches yesterday have completely eased but not completely disappeared in the larger on-demand rollout of the COVID vaccine. The centre has now decided to allow even private hospitals not affiliated with Ayushman Bharat, CGHS and the state schemes to be included in the centre for administering the inoculations. The centre's decision will effectively allow the inclusion of some of the bigger private hospital chains as well as standalone medical facilities. To discuss this and more, we've got with us Gautam Khanna, CEO PT Hinduja National Hospital, as well as Dr. Niranjan Hiranandani, the co-founder and managing director at the Hiranandani Group of companies. Gentlemen, lovely to have you both on board. Dr. Hiranandani, why don't I begin with you, just talking a little bit about how you've seen the overall progress of the vaccine take place, and do you think that it was inevitable that the private sector hospitals, standalone medical institutions, it was needed that they step in order to ensure faster and smoother progress of the vaccine?
There was no doubt. On one side, we have plenty of vaccines. In fact, we are exporting them. We are reaching them to various countries of the world. And we are not able to vaccinate our own people, even the complete health workers, the people who are of an age above 60, elders and other people, we have not been able to vaccinate. And you can see the rush that has taken place in the few centers that we have. So there's a very big contradiction that took place, wherein we had the vaccine, we had everything organized, but we were not giving it to the private hospitals to do so. While the private hospitals had done a fantastic job at looking after the COVID patients during the problem of COVID and hospitalizing and taking care of them. So I think it's in fitness of things that they were given this job. We are ready to take it up. We are in fact ready. We are already operational, and we're just waiting for the final orders to come in for our private hospitals to start delivering the vaccine. So the answer to your question is very simple. Yes. If you really want to vaccinate most of the people quickly, you need to get all the resources together, the government hospital, the local municipal hospitals, the private hospitals. And there is a lot of confidence of the private hospital in the neighborhoods in which they function. So I think you're going to see a wonderful job happening in terms of getting vaccinated most of the people. And if that happens quickly enough, which it will, now that they've given the green signal, I think we will be able to get over the COVID story within 60 days' time. You will see the coming down of the numbers perceptibly, and we need to do it. We need to take care of our own people, and I'm glad the government has given this decision from the center.
Okay, just to get in your view then as well, Dr. Khanna, as to Mr. Khanna rather, as to what the outlook is in terms of how this is really going to work. So now it means that the private hospitals will be given the vaccines, or do they have to procure it themselves? And how soon after all of the approvals are actually in place and this can begin functioning?
So thank you first. Thank you for getting me on the show to give my views. So I am also the representing the Association of Hospitals in Mumbai. So from the association's perspective, all the hospitals and our Hinduja hospital, we've been ready with the protocols and the center because we were vaccinating our staff. So all our protocols are in place, our people are in place. So things were all set. But now with the new changeover since March 1st, we had to do a little bit changes, but all that is done now. The process now is that the government, we will have to procure the vaccines from the government. We have to pay and we have to procure the vaccines from the government. And there is a system that around 50% of the people have to come through the appointment from the app, and the rest of the people will walk in, and then we will give the suitable time to them to come and get themselves vaccinated. So that process is in place, and currently most hospitals have whoever has been vaccinating their staff and us. We are ready to operate from 8 to 8 in the full day. And so depending on how the crowd is done, and we have to manage the crowd, keeping the social distancing in mind and also doing scheduling, we will be in a position to do that. And I think I just want to thank the state government officers and the municipal commissioner who have gone the extra mile and got this done for the private hospitals, because this is a service which the hospitals have been doing since the COVID days to take care of the COVID patients, and we have dedicated beds and things like that. And now this is the time to do the service to the population of the country. So we are with the government to vaccinate as much as possible, as quickly as possible. And I'm sure this joint partnership will reduce the burden of disease in the country.
Right. Mr. Hiranandani, let's, as you said, that it can be done in 2 months, 3 months, or maybe slightly within that. But, increasing the number of centers, increasing the sources where people can take vaccine is probably the best way to reach most number of people. And this is probably that last phase where we are looking at a maximum expansion. And now we've had Mr. Modi himself, a lot of ministers who have taken the vaccine. So the confidence itself is increasing that, the vaccine is safe, or the hesitancy that was there earlier may now not be there with a lot of people.
I completely agree with you. There is no doubt now in anybody's mind that the vaccine is doing its work. It's now tested out all over the world, different vaccines, of course, and we are quite satisfied that the vaccine may not eliminate COVID, but it will certainly completely eliminate the mortality which is taking place. So you may just catch a COVID, but the immunity that you will have is certainly going to be helpful to you so that you don't have any serious symptoms or disorder to do so. So I think it'd be fantastic. And the faster that we do it, the better it is for especially places like Mumbai, Delhi, and all congested areas which have huge population and density. I think the faster we are able to do it, the better. And I think the way to go is now. And I think, as our friend just mentioned, we are all ready to do 8 to 8 and work out this as fast as possible. The cost is not relevant. If the amount is available to us at a subsidized rate or the full rate, whatever it is, we need to do it as quickly as possible. And the response of the people earlier was people were scared because various newspaper reports gave different versions of it. But I think after the Prime Minister has himself taken the vaccine, I think it'll bring confidence to each and every one of them that they would like to take the vaccine. And I'm all for it, all game for it. We should go for it as quickly as possible. We have had enough economic setbacks because of the COVID story. And we need to do this vaccination and to put the story behind us, and we should forget about it. There are so many diseases in our lives. They don't overwhelm the economy or the situation as this one has done. So I'm hopeful that with this drive that should take place as fast as possible, quickly as possible, with the cooperation of each and every one. And of course, as our friend has said, grateful to the government, grateful to the municipal commissioner, the authorities which are actually cooperating tremendously with us in order to make this happen.
Right. Gautam, you're at the thick of the things when you talk about the hospital that you operate in. You daily meet a lot of customers, a lot of people who probably want vaccines but were not eligible earlier. But now with private hospitals getting the vaccine or giving the vaccine, you think the eligibility would also come down pretty significantly as the centers increase? So that will have a mass sort of a expansion as far as vaccination is concerned?
I think you mentioned earlier about the increasing the number of centers, and I just want to caution you a little bit that when we do the vaccination, we need to have a proper center and proper protocol, because we have to have an area for observing the vaccinated people for 30 minutes, and we need to have a place for emergencies. So it cannot be done in each and every place, and the government has to inspect and people have to do as per certain protocols. Having said that, still I think there is a huge chance to expand rapidly across the country. Now, talking about the number of people who are eligible, I think the number of people eligible are in the range of 30 crores, if I am not wrong, as of now. And I think 30 crores itself will take us a few months to complete. And earlier there was some hesitancy, but now more and more people are coming forward. I think after the initial few days where we will have to sort out, just clean up the process a little bit and make it a little smoother, it will become a smooth sailing, and we should be able to finish it in a couple of months.
All right, gentlemen, it's been a pleasure chatting with you. Many thanks for joining in, Dr. Hiranandani as well as Mr. Khanna, and just giving us a perspective as to what the inclusion of private sector for the vaccine rollout is really going to mean for the country.